From Rectangle Health, this is the Modern Practice Podcast. Every episode, we tackle a timely topic to help you stay current and simplify the business side of healthcare. Without further ado.
Hello, everybody, and welcome back to the Modern Practice Podcast presented by Rectangle Health. Happy New Year to you all. I hope you had an amazing holiday season. We're excited to have you back for the first of many new and exciting new episodes. 2023 was an incredible year for Rectangle Health and this show. I cannot thank you enough for all your support, feedback, questions, and suggestions. And as I mentioned a moment ago, we've got some great discussions lined up for you, kicking off today with episode 2 of our Partnering for Success mini-series. For many businesses, an alliance or partnership can prove highly beneficial in the short and long term, unlocking new revenue streams and future business contacts and the like. We're going to dive into this topic and more with guests Chris Poche, VP of Strategic Partnerships, and Allyson Thut, Director of Partner Development at Rectangle Health. Chris and Allyson both joined us about a year ago. I can't believe how fast time flies, to discuss the value of partnering with Rectangle Health. I'm excited to have them both back on the show to discuss the latest enhancements, innovation, and integrations transforming the way healthcare industry manages the business side of care. Allyson, Chris, Happy New Year and welcome back to the show.
Happy New Year, Gary.
Happy New Year. Happy New Year, Gary. And we are incredibly excited to be here.
We are.
Well, I'm incredibly happy to have you and excited to do this show. Thanks so much for taking the time and getting right into it. When we initially met to discuss you both joining me on the show again, Chris, you, in true Rectangle Health fashion, simplified sort of the foundation of how a partnership with Rectangle Health works with a really great analogy. I think it's a good place for us to start. Can you speak to our audience about that framework?
Yeah, absolutely. So Gary, when we think about partnering with Rectangle, we want to make it simple. And so over the past year, we have accepted and brought on board just an unbelievable number of new partnerships that we're incredibly excited about. But at the same time, as the partner division has evolved and grown, so has Rectangle. We've evolved and grown our own solution set. And so what does that mean? Well, for a lot of our partners, they are very good at payments. And specifically where we work exceptionally well together is we help build the value proposition for patient payments. But as our mission statement suggests, we want to simplify the business side of healthcare. So that means more than just payments, right? So, for us, the way that we think about the business side of healthcare, it's compliance. It's how do we engage with our patients? How do we communicate with our patients? How do we make it more efficient for the practice to run the business side of what they do? At the same time, how do we give the patients a great experience? So what we like to tell our partners is, you are great at payments. And the analogy that we all like to use is, look, we all have these smartphones. And whether you're an Apple user or an Android user, it's the same analogy. Today, you're going to an AT&T, a Verizon, a T-Mobile, and you're getting this really cool piece of technology. You're getting this iPhone. And this is important for AT&T because they get to monetize data. And that's their primary business model. They get this really cool piece of technology in your hands, and then they monetize the data that you pull in. Meanwhile, now that you have this really cool piece of technology, what happens? Apple or Google, they have this really cool thing called the App Store. And the value of this device increases exponentially as you download all these apps to help you run your life. So is it tracking fitness? Is it your ticket to, your upcoming, flight? You name it. These phones now do it. And so the value of these phones increase, thereby increasing the value of the relationship between AT&T and their customers. It's no different with Rectangle and Practice Management Bridge. we like to tell our partners, let's work together to get as many instances of the platform Practice Management Bridge into the hands of your healthcare clients. And then as you get to monetize patient payments, Rectangle will come alongside you and build the value of the platform through things like HIPAA compliance or OSHA compliance, through things like scheduling integration or two-way text communication, thereby increasing the value for the practice, which means we're increasing the value of our partner to that practice.
Yeah, thanks, Chris. And I love that analogy, and I want to piggyback off of it. And Allyson, I'll turn to you for this. If I'm an organization that isn't too familiar with Rectangle Health or the Practice Management Bridge platform that has that HIPAA compliance, that has that engagement element, remove the functionalities or capabilities from the picture for a moment. We'll get to that in a sec. What's the value of working with Rectangle Health?
Yeah, it's a good question, Gary. One that we love answering. Rectangle Health, we're not new. We're not new to the space. Rectangle Health is a 31-year-old company, and we have been exclusive to healthcare for our entirety. We're really, really proud of that. Our experiential knowledge of the pain points that healthcare providers experience, our experiential knowledge of healthcare practices needing support to simplify the business side of healthcare, that's our day in and our day out. That's our everyday. Taking feedback from healthcare providers. What do they like? What do they not like? What's working? What do they need help with? What are they struggling with at their practice? We're constantly taking that feedback just from healthcare providers. So Rectangle Health, the support that we lend our partners with our experiential knowledge in healthcare really sets us apart. I think that's a game changer for our partners. Our partners don't have to be that healthcare expert. They don't need to know the ins and the outs of those pain points. We do. And we're going to lend our support and expertise to our partners through partnership.
I love that. It's about expertise, market expansion, speed to market is something that Rectangle Health is very strong in, and obviously with all the new layering into the Practice Management Bridge platform, we're seeing a ton of new innovation. And that I want to shift back to the product, the solution, Practice Management Bridge. It's, Chris, you mentioned it's not just a payment platform. And since our last conversation, a ton of changes and enhancements have been made to the software. Based off that analogy you spoke about a minute ago, can you shed some light on what they are?
Yeah, absolutely, Gary. So since we last spoke, again, Rectangle Health has continued to evolve, continued to grow, continue to expand, our reach into healthcare to help practices. And again, I'm going to go back to our mission statement: simplifying the business side of healthcare, not just patient payments. That is an incredibly important component. We want to make sure our practices can actually collect the money that they're owed for the services that they're delivering to patients. But it's more than just that. And so since we've last spoken, we've acquired and incorporated HIPAA and OSHA compliance. This is a massive undertaking for most practices. We want to simplify that. We want to take patient engagement, and we acquired a patient engagement solution and incorporated that in the platform so that with one or two clicks of a button, an office manager can reschedule an entire day's worth of appointments if, the need arose. And instead of taking typically a half a day and hours on hours to figure out that calculus of who goes where and when and why, click, done, massive time saving. Just patient communication, patient financing. We've partnered with a top patient financing company in the marketplace to help patients simply afford the services that they need. And so when you think about all of these simplifications, all these efficiency gains, the product of simplifying the business side of healthcare should mean that we leave more time for our practices to do what's most important, patient outcomes, patient care. And so the humanistic side of what we do, this is incredibly important to us because we feel like we can make a demonstrable impact to not just bottom line, right, dollars and cents, but literal patient care outcomes, improving, the care of you and I, Gary.
I love that. And I want to bring it back to potential partners now. And Allyson, we just spoke about all these enhancements, layering in tools and functionality to really simplify the business side of the care. And I imagine when you're looking to form a partnership with any company, it's got to be strategic and make an impact. So what do these enhancements mean for an organization that decides to, join forces with Rectangle Health?
Yeah, good question. I think it means a few different things for our potential partners. First, an increased revenue opportunity. When we're able to add on these additional apps, these additional enhancements to the Practice Management Bridge platform, there's an additional revenue opportunity for our potential partners. We're bringing in value beyond just payments, and that monetarily can mean that additional revenue stream for partners. I also think that it means happier customers. Chris talked a lot about that patient experience, the practice experience, them, a healthcare provider being able to prioritize patient care, giving them that time back through our platform. It really does simplify the business side of healthcare, makes them a happier customer for our partners, leading to a longer life cycle that our partners experience when their customers are using Practice Management Bridge.
I'd like to expand on that. So I'll ask you both, as you speak to the decision makers, the existing partners even, what's been the feedback you're hearing when you inform them, yes, there is payments, but there's also compliance, patient communication and engagement, and financing? Chris, I'll let you go first.
Yeah, I think the quick and easy answer is it's overwhelming excitement. Our smart partners know that when we layer in this value that wraps around payments, this is expanding their value proposition, right? Which means with an expanded value proposition, you create higher price thresholds. And simultaneously, you protect these clients. So higher value proposition means higher margin threshold and longer tenured clients, kind of a no-brainer. And that's the value of wrapping around, the whole business side of healthcare using this platform, just like we all pay an ungodly amount of money for these iPhones today, but we do it because there's this amazing value proposition that makes these phones indispensable. And from our perspective, and again, our smart partners, they get it. We want to make Practice Management Bridge indispensable to a practice. So,
Allyson, what are you hearing?
Yeah, I'd echo what Chris said. A lot of excitement. The only other piece that I'd add on there is our existing partners are sharing with us that they're no longer intimidated by healthcare. Previously, partners before onboarding with us would be intimidated by healthcare. Healthcare can be new for them. It can be scary. It can be overwhelming. There can be a lot that goes into it with different unique pain points, different unique nuances, and all the different software solutions in healthcare. But our smart partners that lean on us, trust us for our expertise, and really follow our partner program, they're no longer intimidated by healthcare.
Yeah, and you touched on something, that intimidation. I want to kind of come back right back to you, Allyson. For organizations that are not in the healthcare space, I'd love your input on, is there opportunity? What is that opportunity for those organizations? And I can imagine there's probably a higher level of discomfort and sort of dipping your toes in the healthcare space, right?
Yeah, there is. Like I said, healthcare being so overwhelming. There being so many different software solutions, it's okay that they're not an expert. They are an expert. Our partners are experts at deepening relationships, building and creating relationships. Their associations, their referral partners, their sales distribution. That's what they're experts at, which is great. So then partnering with us to lean on us for our healthcare expertise, it's a win-win.
Yeah, absolutely. Chris, if you came across if you had a potential conversation with somebody with a decision maker not in the healthcare space, really, how do you sort of guide that conversation?
Yeah, I think it's a great question. You said a very important word, and Allyson repeated it as well: intimidation. There is a lot of intimidation in healthcare. Let's face it, it is a massive industry. It is a fifth of this country's entire GDP. By the way, it's also governed heavily with regulation and compliance and software. All things that to the untrained person could be very scary, very intimidating. But at its core, Allyson's exactly right. It comes down to relationships and gaining access to a conversation. That's what we tell our partners. Can you gain access to a conversation with a healthcare provider? If yes, we can help. You don't need to be the expert. You just need to be the person really good at relationships. And we will come in, lock arms with you, and we will be the expert on your behalf. We will help build that value proposition. So, for us, we don't look for partners in the marketplace that are unbelievably well-versed in healthcare or software. We look for partners that have access to healthcare, right? Like Allyson said, through their own partner channels, through their own just sweat equity, hey, they can get access to these conversations, and then we win together at scale.
Sounds a lot like that consultative approach we spoke about last year. So I love that, and thank you both. So last question before we wrap up this episode. Again, last year when we connected, I asked what sets Practice Management Bridge, Rectangle Health, apart from others? What's the game changer? Because so much has changed since then, I'd like to get your unique takes on that, 12 months later. Allyson?
Yeah, I would still stick with it's our platform. It's Practice Management Bridge. It is the software solution that simplifies the business side of healthcare for our healthcare customers. We can give our users time back in their day to focus on patient care. Our experiential knowledge of what they need help with, pain points that they struggle with day to day within their practice, we're solving for that. Our innovative team just continuing to enhance Practice Management Bridge, the platform, that is the game changer. And we're continuing to evolve and expand, and so much has changed in the last 12 months, which is super exciting.
Absolutely.
I wait to see what the next 12 months bring.
Yeah, that's for sure. Chris, what's your take on that?
Yeah, so we've talked a lot about the platform and its advantages and benefits in the marketplace. We've talked in the past about Rectangle's history and how 30 plus years of an exclusive healthcare focus, which is what's kind of informed the solution to this point, because we've been highly attuned to the pain points in the marketplace. But I'm gonna stick on a concept that we've said multiple times, and I'm gonna take a very simplistic approach here of what sets Rectangle apart. It's the people. It's the people like the Allyson Thuts that are out there holding the hands of new partners and bringing them into this opportunity. It's developers that are continuing at a light speed pace, redeploying new solutions and increasing the value proposition of our platform in the marketplace. It's our healthcare business consultants that, again, act as extensions of our partners to become experts. It's the hundreds of people across the entirety of Rectangle, Gary, even like yourself, helping us evangelize what we do, why we do it, and how we do it. That is what sets Rectangle apart. People.
Yeah, couldn't agree more. Thank you so much for that, both. And again, thank you for your time. And for our listeners tuning in today, if you missed the first episode with Chris and Allyson, I'll have a link in this episode's description for you all to listen in. You'll get a really good sense of how quickly Rectangle Health in the past 12 months has evolved by listening to that episode and now tuning into this one, and continues to move onward and upward and providing value to the healthcare industry. I'd love to have you both back on in the near future to give our listeners more insight to the innovation coming out of Rectangle Health, because we know it's coming. But in the meantime, what's the best way for our audience to get in touch with you to learn about partnership opportunities?
Yeah, I would say LinkedIn or email. In the show episode notes, we'll display our contact information, but Chris and I are both on LinkedIn and would love for y'all to reach out and inquire and learn more about partnership opportunities.
Perfect. I'll be sure to drop those profile links in this episode's description, and I highly encourage you all to reach out and connect with Allyson and Chris. As you heard today, they're a wealth of knowledge and leading the Rectangle team in building mutually beneficial relationships. Thanks again to you both for taking the time.
Thanks, Gary.
Hey, thank you, Gary. This is great.
Pleasure's all mine. And for our audience tuning in today, as always, if you enjoyed the episode, hit that subscribe button on your favorite streaming channel. Leave us your comments, feedback, and questions. We love hearing from you. And be on the lookout for more great episodes of the Modern Practice Podcast coming soon. Thanks for tuning in. Till next time, everyone.
Thank you for listening to the Modern Practice Podcast. If you enjoyed today's conversation, subscribe on Apple Podcasts, Google Play, Spotify, or SoundCloud for new episodes. And follow Rectangle Health on social media for more helpful information, news, and event details. Thanks for tuning in.